Morning, everyone. Can everyone hear me okay? That's a good start. So we're delighted to be here today to talk about some research that we've been doing. Okay, I'll try not to move around so much. So we have recently finished a project that we've been running within the veterinary sector that's focused on alcohol use and mental health and pathways to help seeking within the profession. Okay. So today, we've only got a short window, but we're going to give you a whistle-stop tour through the project. We'll cover the background to the topic and why it's important and why we should be paying more attention to this in the future. And then we'll go through the study itself. I'll then pass over to Olivia and she will talk you through some of our findings. And then we'll finish up with some takeaways and what this means for practice going forward. Okay, so what is the background to this? What do we know already? Now, it might surprise you to know that we don't actually have very much data about alcohol use within the veterinary profession. Work just hasn't been done yet. But what we do know is that there tends to be higher rates of alcohol consumption within the profession when we compare that to general population. So that means that people are at increased risk for experiencing alcohol-related harm. We also know that people who are drinking at those kind of risky levels, they're more likely to drink for reasons related to coping and to coping with stress, and that in turn is related to poorer mental health. We also know from our own research that there is a kind of a normalised culture of heavy drinking within the veterinary profession that's been reported by our participants, and that this goes hand in hand with high levels of alcohol-related stigma. So if people cross that sort of invisible threshold into experiencing issues with their alcohol use, they then feel that it's a very stigmatized space and that they're unable to speak out and to seek help and to access support. And people are also quite fearful of seeking help because of the perceived negative implications that it can have to people's careers and their career progression. So it's clear that we need to know more about this as a topic. We need to better understand the use of alcohol within the profession. And we may also need to develop targeted interventions to help people that people feel able to access and engage with. Now, the first stage of this is often to use a well-known framework called the COM-B analysis. And the COM-B framework is used to understand human behaviour. So it's made up of three distinct domains. The first is capability, which, as you might expect, is the person capable of performing that behaviour. So in this case, are people capable of talking about their alcohol use issues? Do they know where to go to access help and support? The second is opportunity. So are people in an environment in which they can perform that behaviour? You know, for example, do they have supportive colleagues that will be supportive of them if they are to seek help? And the last is motivation, and that's broken down into automatic motivation and reflective motivation. So that's kind of conscious decisions as well as impulses and habits and emotions. So things like, you know, as a person, do I feel deserving of support, for example, or would seeking help negatively affect my career prospects? And we've used this framework within the current study to understand alcohol use as a behaviour and alcohol reduction, but also as the first steps of intervention development and understanding help seeking per se. So what do we set out to do? So we have three broad aims that we want to cover. The first was to better understand the factors that are associated with hazardous and harmful drinking. We also wanted to better understand the relationship between alcohol use and mental health. And crucially, we wanted to have a better insight in terms of what are some of the factors that either facilitate or inhibit people's ability to seek support for alcohol use. So, onto the study itself. So we ran an online survey. If anyone's super interested, we have the protocol for the study, which is available through the Open Science Framework. So you can scan that QR code, and that will walk you through the study in minute detail. In a nutshell, the study was an online survey of veterinary professionals in the UK who had consumed alcohol within the previous 3 months. And we collected data on a variety of different measures, so things like alcohol intake, motives for drinking, mental health quite broadly, and then also some questions in relation to the COM-B framework. just before I pass over to Olivia to talk you through the results, I do want to acknowledge the contributions of our public advisory group. We had 5 fantastic individuals that we've worked with throughout the process of conducting this study, who came from very diverse backgrounds, some of whom had lived experience of drinking at risk levels, and they have been really instrumental in terms of helping shape the recruitment strategy for the study, as well as shaping some of those materials that we put out into the public domain. And now, as we move into the dissemination phase of the study, they'll also be involved in some of that work as well.
So I'm delighted to say we had brilliant uptake for the survey, with 652 completed questionnaires included in the study. That was 652. See, 62% were vets, 30% were veterinary nurses, and 8% were other in-practice veterinary roles, and that consisted of veterinary care assistants, reception staff, practice managers, and other non-specified roles. Most participants were female, white, heterosexual, and worked in small animal practice. And though these demographics are quite homogenous, according to the most recent surveys of the veterinary and veterinary nursing professions, it is representative of the veterinary population. So we think back to our study aims. We were interested in the factors associated with harmful and hazardous drinking. This was defined using the Alcohol Use Disorders Identification Test, which categorizes drinking into risk level. Firstly, it's important to point out that 40% of our participants were at some level of alcohol-related risk of harm, meaning they were drinking at harmful or hazardous levels. As we might have expected, demographic characteristics associated with this were being a man and older in age. Notably, alcohol risk was comparable across veterinary role, suggesting that harmful and hazardous drinking is an issue that widely affects all veterinary roles. Poor mental health was also associated with alcohol risk. We look into this in a little bit more detail. We found that greater psychological distress and lower well-being were linked to greater alcohol risk. In addition, drinking to cope seemed to amplify this relationship, suggesting those with poor mental health who drink to cope will be an elevated risk of alcohol-related harms. So though these relationships have been demonstrated in the wider population and therefore not specific to veterinary workers, they do have important implications given the high levels of mental health conditions and working demands faced by the veterinary professionals. We used a multiple linear regression model to identify predictors of alcohol risk. And we found that individuals drinking at lower risk, so not at harmful or hazardous levels, were likely to possess the capability, opportunity, and motivation to do so. So what does this mean in real terms? Many of this feels quite intuitive, but lower risk drinkers would be more likely to report having good knowledge of low risk drinking, which is 14 units or less a week, and having at least 2 alcohol-free days. And they believed they were capable of adhering to these behaviours, that they had the self-efficacy to turn down a drink or limit their alcohol consumption. In addition, external factors from an individual's social and physical environment were also shown to give the opportunity to drink less, and included having an enabling lifestyle, believing that colleagues also drank at low risk levels. Lower risk drinkers also reported automatic motivating factors, such as drinking not being part of routine or habitual, and not drinking to cope with work stresses. And lastly, more deliberate and conscious motivators also predicted low risk drinking. Things like feeling colleagues would be supportive of alcohol-related issues, and that help seeking is a good thing to do. In the same multiple linear regression model, we found that those who were at greater risk of alcohol-related harms reported drinking for different reasons. So perhaps most strongly, they reported drinking to cope with mental health conditions and negative emotions, but also drinking for enhancement. So in other words, drinking for pleasure or to heighten positive mood. And our final aim of the study was to better understand potential enablers and barriers to help seeking and alcohol reduction, which we did by looking at the correlations between COM-B and alcohol risk levels. So individual factors seem to be associated with enabling help seeking. So not surprising, identifying and recognizing a need for help, as well as having the self-compassion and feeling deserving of seeking help in the first place, were likely and logical facilitators. And then feeling capable to be open and to talk about alcohol-related issues is another quite intuitive enabler, and this also maps onto other findings from other help-seeking studies. On the flip side, we found that help-seeking was likely to be hindered by self-stigmatizing views, such as seeing alcohol-related issues as a personal weakness or failing, and then perhaps an extension of this, also perceiving that others working around us, our colleagues, would judge us and look at us differently, perhaps in a more negative light if they knew about any potential challenges we were facing with alcohol. So we did the same with alcohol reduction, and again, these findings were all quite logical. Reduced drinking is likely facilitated by things like having awareness and understanding of what low-risk drinking entails, as well as feeling you have the self-efficacy and intention and desire to limit your drinking. And conversely, potential barriers included having an attitude that drinking is intrinsically part of socializing with colleagues, or that it's habitual, or that drinking is part of coping with work pressures. So we had a lot of data. So main findings, take-homes, harmful and hazardous drinking is associated with poor mental health and drinking to cope amongst veterinary workers. Those who drink at greater risk levels do so for different reasons. They may drink to cope, to relieve stress and negative emotions, or they may drink for pleasure and to enhance mood. And lastly, this study has given us a better understanding of the factors that may facilitate and prevent both help-seeking and alcohol reduction. And really importantly, this leads me on to consider some of the implications of these findings. So going forward, in the context of further research and evidence-based intervention development, we should take into consideration the association between at-risk drinking, poor mental health, and drinking to cope. This could be key in changing both drinking behaviours and cultural norms around drinking and help-seeking. More broadly, in veterinary workplace strategies, we need to be encouraging being more open, less judgmental about concerns over drinking to reduce the stigma around it. This isn't going to be simple or an overnight fix. These attitudes and beliefs around drinking are culturally entrenched, not just within the world of veterinary, but more broadly in the general population, with alcohol being one of the most stigmatized health conditions, mental health conditions. Along with this, we also need to work to address the cultural normalization of drinking and this idea that after a difficult day, we need or deserve a drink to recover or decompress. Perhaps replacing this with healthier coping strategies that allow us to process challenges we're facing both personally and professionally. And we must raise awareness of where, who, and from how, from where, how, and from whom to seek support. Just as importantly, we need to foster more positive attitudes around this, reminding people that it is a good thing to seek help, that they are deserving of it, and that with the right support, it can be successful. Are there any questions?
Thank you both. Does anybody have any questions for our speakers?
Hi, thanks for that. Really interesting. What role do you think perfectionism might play in predicting greater alcohol risk?
I think that links in with our sort of self-critical views and self-stigmatization, which we found in our first study to be a barrier to seeking help for alcohol use in vets. So I think that is a really interesting question and something that, certainly probably does play into this. Would you have anything to add?
I'd just like to add that we had some really fantastic talks this morning about the journey that the profession has been on in terms of mental health over the past 10 years. And I can see really clear parallels between that and the topic of alcohol use. And we're not quite there yet when it comes to the topic of alcohol use. We still have quite prevalent stigmatized attitudes. We've started to make progress in mental health more broadly, but we haven't made the same changes when it comes to mental health, to alcohol use specifically. And again, this morning, the And Me campaign was mentioned as a key vehicle in promoting that change. But alcohol use dependence wasn't featured in the And Me campaign. So there's still a lot of work that could be done. And it was really heartening to see the direction of change that's happened over the past 10 years. And we very much hope that this is going to continue and that we'll see positive change in the alcohol sphere as well in the future.
Oh, is this on?
When you looked at the risk factors for heavy alcohol use, did you look at protected characteristics or being a marginalised, part of a marginalised group as a risk factor?
In terms of demographics?
Yes.
We did, and nothing came up on the statistics.
Thanks.
I'm really struck by the stark contrast between what you basically social drinking is so not stigmatized. It just seems this is a much bigger, society-wide issue. Social drinking is encouraged, not stigmatized, and yet if you are seen to have a problem, it flips to this stigma, and I'm just really struck by that. Just wanted to say that.
Yeah, I think that's a really good point. You know, we drink to celebrate, we drink to commiserate, we drink to unwind at the end of the day, but there's this sort of invisible line that if you cross that line and then you start to experience problems, well, actually, that's your fault. You know, you are to blame for this. When actually our social environments promote alcohol as a way to cope with a variety of different things. And there's this ethos in terms of personal responsibility, which then leads to personal blame. So it's about changing the narrative. And also it's about having open and honest conversations. And those conversations aren't happening yet. And that's not specific to just the veterinary profession. They're not happening across the board. You know, they're not happening in the general population. They're not happening in other workplace sectors. But in the veterinary profession, when we see such high rates of mental ill health and alcohol use goes hand in hand with that, I think we need to be having those conversations about alcohol use. And that is the next logical step.
And just to add that I think that it feeds into that feeling of self-stigma, because from participants we interviewed in our first qualitative study, you know, we're hearing things like, you know, why is it me that's having the issue with this? Everyone else seems to be fine with it. And I think, yeah.
With the Collective Trauma Summit starting this weekend, I just want to ask a question about generational and collective trauma here. And was there any sense in your work of generational shifts, but also how we're addressing generational trauma? Because obviously this is a numbing issue, so there's a trauma awareness issue. So I'm just wanting to see if you're seeing anything happening at a generational level.
So we didn't look at trauma per se. If we look at the kind of wider demographic changes that we've seen in the alcohol use field in large, we are noticing a shift that different age cohorts are drinking in different ways and in response to different factors. So older cohorts, as they are currently aging, they are drinking at increased rates in comparison to younger populations for the first time in a long time. You know, the narrative that we've always had is, it's the young people that we need to be focusing on, that they're the ones who engage in risky drinking. Actually, what we see now is that that's not the case. That it's our older population of adults, usually from about midlife to the ages of about 65, that represents our most risky populations. We saw in the results of this study that, you know, people who are most at risk of alcohol-related harm were older, so that fits with that data. How that is informed by kind of trauma, we don't know, because that wasn't something we looked at in this particular project.